Hi, Veg Heads. November 29th. Can you believe it? We are really in the end days, the end times for World Vegan Month. And thank you, all of you who've been sticking with me. I've gotten so many nice emails and so many nice texts. And one thing, some people were planning to try to rev up a little more in December, be a little more vegging there better than this last month. They've been dipping their toes in the water. So now some people were saying, what for my health should I do? And obviously, I correct you immediately. Don't ask me about your health. You have a doctor, and you can do some pretty good research with plant-based vegan physicians online. And also, there are physicians who are not themselves plant-based or vegan, but they do know that eating a highly plant-based whole food diet is going to help you with a bunch of your health, especially chronic health concerns, things like high blood pressure, cardiovascular disease, high cholesterol, type 2 diabetes, prediabetes or metabolic syndrome, inflammation, all kinds of things. And so one of the things you can talk to your doctor about is, if you want to really get some good data, is getting a blood test towards the beginning of your challenge, your 30 days or 6 weeks or 60 days is usually I suggest people try 6 weeks if they're trying to really change something about their blood numbers, their readings, their laboratory results. But the best way is to know what your lab results are going into it. So even people who eat what they consider quite healthfully may have some elevated risk factors in their laboratory results. So consider getting lab results so that you can use your own judgment combined with the judgment of your physician at the end of 6 weeks. I know when my husband first really began to limit his animal products and become very, very diligent about eating a whole food diet, he had quite elevated cholesterol numbers consistently for a number of years, elevated blood pressure. I don't think he had anything else, not that he shared with me anyway, that was considered an issue. After 6 weeks, those tests were repeated and they were well below the concerning range. His physician had been encouraging him to go on high blood pressure medications and statins to lower cholesterol. There is no longer a need based on his lab results for him to do that. And that's been about 5 years. So that's very nice news. So I think it would be great for you to also be able to evaluate if your concerns are your health, and I think they should be in general. You would like to have those numbers to see, has it made any difference at all? Some people want mostly to drop a few pounds because lowering your weight, if you're overweight at all, can be an issue that exacerbates some of your health risks for chronic health problems. So I encourage all of you to continue, even with the pandemic, figuring out how to get routine, good care from your physicians, get good lab results, clear lab results, so that you can decide for yourself what it means vegging your best. Some people, from a purely health standpoint, will be happy just having some meat now and again, or limiting the amounts, or limiting the kinds of meats that you eat. Others really are coming at this from a more ethical or political or environmental point of view, and that will be a slightly different determination. But in any event, you want to make sure that if you have a health concern, that you are sharing that health concern with your physician, okay? But consider doing some results, getting your lab results first, and then seeing, and if you're really doing it, I think you'll see results. I talk to people all the time. It's made a big, big change for them. It changed for me, changed for my husband more recently, and this is what we want. We want a universe, a world of people as healthy as we can possibly be. Okay, bye guys.